we can check that the movement of the teeth, that we have balance. And what we might do is after this, just take a close-up of me moving the teeth. So I've just made sure that there's a nice coating of water on the dentures. And I'm just checking the stability and making sure that when I tap my fingers from side to side, that denture's not moving. And that's good.
ចឹងមុននឹងពេលយើងដាក់ denture លោចូលក្នុងមាត់អ្នកជំងឺយើងគួរតែដាក់ត្រាំនៅក្នុងទឹកបន្តិចដើម្បីឲ្យមានសំណើមហើយនៅពេលដែលយើងដាក់ denture ចូលក្រោមយើងអាចយកម្រាមដៃយើងសងខាងដើម្បីទៅចុចលើ denture មើលពី stability របស់ denture.
And again with the upper one, I'm just checking the stability by pushing my hands from side to side. Come a bit closer, Kenny. Come in.
ផ្នែកខាងលើក៏ដូចគ្នាដែរគាត់ទៅឆែកមើល stability ឲ្យគាត់រំកើដៃគាត់មកខាងមកខាង
So that upper denture is fitting really nicely and it's not bouncing or rocking.
ហើយយើងឃើញថា denture គឺ fit បានល្អវាអត់មាន bounce ទេ
Got a little bit of an open bite there. You see that? Okay. And bought the articulated paper. Just see, is it could well be just heel polish. So what's happening is when the patient bites in the mouth, she's hitting at the very back first, and there's a little bit of I suspect heel clash. Yes. We'll fix. So I'm just going to pop some paper in. Gone back a little bit.
Dạ, nó coi nóng.
She's gone back a little bit. Yep, no, we just... So what's happened is our patient is now biting just a little bit further back on her teeth. So what we need to do is just take a check centric. So what I'm doing is I'm going to take a check centric. So what I've done is I've put some wax over the back teeth. The reason I'm doing this is that when I look at the bite in the patient's mouth, the teeth are not coming together evenly. And so I'm going to take a check bite So what I've done is I've now softened the pink wax, and I've softened the pink wax by heating up my wax knife.
Come on. Come to
So we can see she's gone further back. We've got our try-in back. We checked it before, and what happened is when I went to check the bite, the patient's old dentures have been so overclosed that she's been pushing her jaw forward. When I tried the new dentures in at an increased vertical dimension, her lower jaw went back. Her condyle went to a higher, more superior position in the fossa.
ก็យើងថាអត់មិននៅពេលដែលយើងលោនោះគឺអ្នកជំងឺមាន overclose ពេលខាងទៅជាការហុញមកមុខខ្លាំងពេកដល់ពេលឥឡូវយើងលោទៅយើងទាញ vertical dimension បានមកវិញប៉ុន្តែកុំដេកយើងទៅជ្រៅពេកហុញជាការទៅក្រោយផុត fossa.
So there are now when you're taking bites, taking the centric, the patient can posture her jaw forward when she's overclosed to get the teeth together, and that's what happened here. Now we've put new teeth in, her jaw's gone back.
អញ្ចឹងនិយាយមិនអញ្ចឹងផឹកមិនដោយសារតែយើងដាក់ទៅចការបស់គាត់ហុញមកមុខដល់ពេលឥឡូវយើងដាក់ទៅចកាគាត់ស្រាប់តែហុញទៅក្រោយវិញធ្វើឲ្យកងឌីរបស់គាត់ខ្ពស់ផុត glenoid fossa.
And there's our resting vertical dimension. And now I'll give the patient her upper denture.
Chum. I hear a noise. Can you put it there?
Yes, suction.
Oh.
And now we can see that we have an OVD which is less than RVD, and we have a freeway space.
ឥឡូវយើងឃើញថាយើងវាស់ occlusal vertical dimension បានហើយដែលវាមានកម្ពស់វាទាបជាង resting vertical dimension ហើយយើងបង្កើតបានទៅជា freeway space.
And I'm just checking interpupillary line is parallel with our incisal line.
ឥឡូវយើងមើលថា papillary line ជាមួយនឹង incisal line parallel គ្នា
And I'm just setting my orange wood stick along the occlusal plane of the upper teeth, and that should be parallel with my alar tragus.
ហើយ
Yes?
មួយទៀតវិញបើសិនយើងមើលពីជាងទៅ occlusal plane ហ្នឹងគួរតែ parallel ជាមួយនឹង alar triangle ហើយមើលទៅ parallel.
Good. The other thing we do is we just check this bite.
ខាងនេះខាង
Midline, our dental midline, the front teeth, midline is the same as the patient's midline.
អញ្ចឹងមួយទៀតគឺយើង check midline នៅពេលដែលយើង midline របស់ក្មេងហ្នឹងគឺយើងត្រូវស្មើស្របគ្នាជាមួយនឹង midline មករបស់អ្នកជំងឺ
And then the last thing we need to check that we've got right is the bite. I put both fingers in, out over the side, and ask my patient to just bite. And we can see, open, just relax. There. See how she went back? She went back.
យើងមើលឃើញចការមកពេលខាងថយក្រោយ
And that's a better bite now. We've got a much better bite.
ឥឡូវគាត់ប៉ុន្តែវាcònបាយជាងមុនហើយ
Yeah, that's good. Very good. So we've actually helped manipulate our patient's jaw back so that her condyle is now sitting in RCP. Okay? Before it was not in the superior posterior, it was down and forwards. Now it's up and back. And as a result, the patient is biting better on her back teeth.
អញ្ចឹងមិញគាត់ជួយឲ្យអ្នកជំងឺកែតម្រូវអាទីតាំងរបស់ centralization កងវាលើទីតាំងខ្ពស់
Nice smile.
Yes.
Nice smile. Yeah. So now we can show our patient, ask her to have a look at her smile. And we like that. So those are all of the steps that you need to do at the wax try-in stage, okay? And what we've learnt today is that sometimes at the wax try-in the bite might not be right and we have to correct it. And it's easier to correct it at this stage than it is to correct it after the dentures have been processed.
គាត់ថានៅពេលដែលយើងបាយហ្នឹងបើសិនជាយើងកែតម្រូវវានៅក្នុងដំណាក់កាលឡ9ហ្នឹងគឺស្រួលច្រើនជាងនៅពេលដែលយើងធ្វើចេញពី denture ហើយ
And just again, when it comes to testing the stability of the denture, you put your fingers in over the occlusal and you bounce up and down, and that denture is not moving. It is nice and stationary. And when I take it out, there's a little bit of suction.
យើងពេលចាំមើល stability ទៀតដាក់ដៃសងខាងយើងលបាត់មើលតែប៉ុន្តែបើសិនជាយើងឃើញថាអត់មានអីទេក្នុងពោះណាហើយដល់ពេលគាត់ជិះវាគាត់មកមានអារម្មណ៍ថាជក់ខ្លាំង
Yeah. And our patient has told me that this lingual flange here is just a little bit long, and we're going to trim that for her before we issue it tomorrow.
គាត់ថាខាង lingual ពុំកែខាង lingual ច្រើនពេកអញ្ចឹងទៅថ្ងៃស្អែកចាំយើងត្រៀមឲ្យគាត់
And the upper is really nice and firm and stable, and it's not moving as I press on it, and I'm very happy. And when I try to take that out, it's got good suction. And our patient has asked, she's just finding that posterior border a fraction long, and we might just polish it back a millimetre or so. And we must always take the pen marks off.